CTV News, Vancouver Island Report.
Good evening. Debate is raging on the North Island over plans for 2 new hospitals. It has been going on for years now. First, it was over where to build them, whether there should be 2. Now it's over how to build them. The plan is for a public-private partnership, but user groups and healthcare unions are against it, saying that public healthcare should be paid for with public money. CTV's Gord Kurbis reports.
Members of the public, I will not tolerate any clapping and no placards and no signs.
They're hoping to temporarily put the brakes on the construction of 2 new hospitals for the North Island. Members of the Citizens for Quality Healthcare are demonstrating at the monthly meeting of the Comox Strathcona Hospital Board. They're angry the hospitals will be built using a public-private partnership.
We are objecting to the anti-democratic nature and the disastrous financial and social costs of hospital P3s.
Clearing of the 2 sites is already underway, but the request for proposals on the construction of the hospitals hasn't gone out yet. P3 opponents want them to go out with guarantees there will be no private funding involved.
What we feel is the majority of people's view that they're against these P3s. They don't want millions of dollars being spent on legal and consultant fees, millions of dollars spent for just so that shareholders can make a profit from the hospitals.
The Hospital Employees Union is also against the idea, saying it's a concept that has failed in other communities.
Public-private partnerships were initiated in the United Kingdom in the 80s, and they have been an unmitigated disaster, and there's plenty of evidence about that. In Canada, the biggest and oldest are in the Ontario, in Brampton. Huge problems there, cost overruns, shortage of beds.
The union calls upon hospital board directors to withhold the transfer of any more funds to the construction projects and to block the issuance of any requests for proposals until they have more time to study the issue. But the board's chair says it has already committed to the P3 concept because that's the arrangement that was put forth by the province in giving its 60%.
When it came to our board in June of 2012, to decide whether to go ahead with our 40%, we knew that it was going to be as a P3.
The chair also tries to give some reassurances that a public-private arrangement actually safeguards public money.
This project is $600 million. If it goes to 610, that extra 10 is borne by the private partners, not by the taxpayers. That's the whole point. If it was a publicly funded and it went over budget, the public would be responsible.
Construction should begin in March of next year with a completion scheduled for the fall of 2017. Gord Kurbis, CTV News, Campbell River.